Hi, I'm Staci Hix-Hernandez, board-certified plastic surgeon here at Beleza Medical Spa. Today we're going to talk a little bit about rejuvenation of the breasts. Similar to my approach with other patients, I feel that when designing a treatment plan for a patient, it is very important to accurately listen to the patient's concerns. That way, I can make certain that I'm delivering to you what you want postoperatively. When we talk about rejuvenation of the breast, there's typically two key elements that women are dissatisfied with, either position of the breast and or volume of the breast. These are two very different issues and need to be addressed very differently. Today we're going to talk about a patient who may want an increase in volume as well as an improvement in the position of her breast. This is going to be addressed with a procedure called an augmentation mastopexy. When we talk about augmentation of the breast, we have two key elements. We have autologous tissue or we have implant-based material. When doing autologous-based augmentation, this is when patients can do fat grafting, which utilizes fat taken from other areas of the body and injected into the breast to increase the volume. When talking about an implant-based procedure, this is where we're putting a synthetic implant into the breast to increase the volume. We do have two implant choices today on the market. We have saline and we have silicone. Both are FDA approved, with silicone implants being available for patients over the age of 22. In this procedure, we're going to talk specifically about implant-based augmentation. If we look at the breast, this is going to be a patient with less than volume that they find adequate, as well as a low nipple position and maybe a little bit of excess skin. If we look deep to the breast, we have a very strong muscle called the pectoralis major. I prefer to put implants in the submuscular pocket or deep to the muscle. I like this for two reasons. One, I find that this gives a very natural appearance of that implant, in that we have this muscle to help camouflage the actual appearance of that implant. The other reason that I like it is that there is less chance of having breast tissue that could potentially be obscured on a mammogram with that implant deep to the muscle. I prefer an inframammary approach, so an incision in the crease of the breast. We go underneath the breast, find the pectoralis major, lift the muscle up, and create a pocket immediately deep to this muscle. Once this pocket is created, we will then slide the implant, which has been carefully selected based upon patients' choices before surgery, into this pocket and close the pocket. That will accurately address the volume issue. However, if we stop there and the breast is in a low position, we could have a situation where if you look at the chest wall, you have chest wall, implant, and then a breast that hangs off the implant. So it's very important that we reposition this breast back up so that it sits appropriately on top of the implant. To do that, we will mark where we want the nipple to end when we're finished with the procedure. From that position, we will pinch and take out the excess skin that needs to be removed. This incision here is then made. An incision is made around the nipple, and the very top layer of the skin only is removed. We will make a full thickness incision around the bottom part of the nipple, which will allow the nipple to slide up into its new position. These two side incisions will then be closed, creating a vertical incision. This process will then be repeated in the horizontal plane, again, marking off the excess skin, making the incision, removing the top layer of the skin only, and then closing it up. So once we are finished, we will have a fuller, higher, and tighter breast. We will have an implant deep. We will have a scar which runs around our nipple, vertical, and again, horizontal. I realize this looks like a lot of scarring. However, the breast is actually very forgiving and tolerates incisions very well. These scars tend to camouflage very nicely. You have a color change here at the nipple-areolar complex and the surrounding skin, so this circumareolar incision fades very nicely. The lower horizontal portion is actually in the fold of the breast. The only way you see it is to lift the breast up and actually look into a mirror, which basically leaves this vertical incision. And again, because the breast is very forgiving, once it fades and softens and remodels, it's actually very cosmetically pleasing. This is done as a day surgery procedure. Will take us approximately 3 to 3.5 hours to complete. Drains will not be required. You will go home in a compression garment that you will wear for 5 days, at which point you will be put into a post-operative bra. Total recovery for this procedure will be approximately 4 weeks, at which point restrictions will be lifted and you will be able to resume all activity as normal. If you have any further questions or you'd like to discuss this with me further, please feel free to contact us and make an appointment, or you can visit us on our website at www.belezamedicalspa.com. Thank you.